Welcome back to our discussion during this World Cancer Support Month. Joining me now is Dr. Mourad Abouelleil, a urologist and surgeon at Good Samaritan Medical Center and the Palm Beach Health Network. Doctor, thanks for being here.
Thank you for having me.
We have so much to cover with you. I know you treat three major forms of cancer: bladder, prostate, and kidney cancers. Let's talk first about advancements in treating all of them, starting with bladder cancer.
Correct. So I'm mostly a urologic surgeon. We specialize in screening for bladder cancer and diagnosing bladder cancer. Usually bladder cancer is diagnosed by a urologist on a screening office cystoscopy or such. Usually this preceded by growth blood in the urine or microscopic hematuria. So we screen the patient. We find that there is a tumor. We undergo biopsy or resection in the operating room. Our role is usually surgical resection of the tumor.
All right, surgical resection is removing the tumor itself. Is it common to remove the entire bladder?
Good question. So usually we like to diagnose bladder cancer early. That's why it's very important to screen and go see your primary care doctor and get annual urine tests. If there is microscopic blood, you have to get a full workup by a urologist, which entails a CAT scan with IV contrast and an office cystoscopy, a camera test to look inside the bladder. And if the cancer is detected early, which in most cases it is, it can be resected through the urinary channel, transurethral resection, and the whole bladder does not need to be removed.
I want to talk more about the other cancers, but because we're on bladder cancer, we saw a lot of public attention because of NFL Hall of Famer Deion Sanders revealing he had bladder cancer and had surgery and is considered cancer-free. Now, Coach Prime, really kind of a new spokesman for bladder cancer treatment. How new is the idea of being able to have this cancer and have it completely removed, and in a couple of months, you're cancer-free? That wasn't the case years ago.
Usually we can diagnose bladder cancer, like I said, on cystoscopy. In more advanced cases, we have to remove the whole bladder. If it's invading into the muscle of the bladder, the standard of care is to remove the entire bladder. And right now with robotic surgery, we're able to do that type of surgery in a more minimally invasive way, robotically, with less scars and quicker recovery and less pain and better cancer control.
Fantastic advancements. Let's talk about prostate cancer, because that treatment seems to be constantly evolving as well.
Correct. So prostate cancer changes a lot in the sense of there's always newer treatments available, but surgical treatment remains top of the line. With radiation therapy, usually one or two, usually both would provide 90% chance of cure. I specialize in prostate cancer, and my role in prostate cancer is usually diagnosis of prostate cancer in the form of biopsy, and ultimately treatment if surgical resection is the recommended method of treatment for this particular patient.
Let's touch on kidney cancer as well. Are there changes in those treatments and detection these days?
There still isn't a specific schedule or screening tools for kidney cancer. It's lumped in with microscopic hematuria, which would encompass bladder cancer. But there isn't really a specific screening tools for kidney cancer. Kidney cancer is usually diagnosed as incidental findings. 90% plus of my patients would come see me with kidney cancer. It was discovered incidentally. They were having stomach pain or having other problems, and on the CAT scan shows a spot on their kidney.
Let's talk, as we have about 90 seconds left, specific screenings or checkups that you recommend to people who may be watching today.
For prostate cancer, we recommend at least getting a PSA once a year, seeing your primary care doctor. Digital rectal exam still recommended. And if there's any abnormality, if there's any increase in the PSA, you should be seeing a urologist. Most of my patients see me about once a year for prostate cancer screening. If there's any abnormality, you could discuss with your urologist whether you want to get a multi-parametric MRI or a prostate biopsy. So,
you hear cancer, and obviously it is so frightening to everybody, understandably so. But let's talk about, once you diagnose it, the prognosis compared to, say, when you were even beginning your career.
Prostate cancer, specifically, prognosis is excellent. We have more than 90% chance of complete cure from the cancer, and excellent, more than 90% 20-year survival. So cancer in general hinges on early detection, early screening.
All right, and that's the watchword of the day, early detection and screening. Dr. Abouelleil, thank you so much for joining us.
Thank you.
On the record, we'll be right back.